Good day, everyone. We were going to discuss the other sleep-wake disorder. But before that, I am Shahana Tan, one of the reporter of sleep-wake disorder. Circadian rhythm sleep-wake disorder. So, circadian rhythm sleep-wake disorder are a group of conditions that affect the timing of sleep and wakefulness in relation to the 24-hour cycle of light and darkness. They can cause problems with falling asleep, staying asleep, or waking up at the desired or socially appropriate times. They can also affect the quality and quantity of sleep and impair the functioning and well-being of the affected individuals. So, in simple term, this disorder mean that your body clock is out of sync with the natural day and night cycle. So, this can make you feel sleepy or alert at the wrong times and interferes with your sleep quality and quantity. This can also make it hard for you to function well and feel good during the day. So the diagnostic criteria of circadian rhythm sleep with wake disorder vary depending on the specific type of disorder, but they generally include first is a persistent or recurrent pattern of sleep disruption that is primarily due to an alteration of the circadian system or a misalignment between the endogenous circadian rhythm and the sleep-wake schedule required by the individual's physical environment or social or professional obligation. So, ito yung mga sakit na nasasangkot ng hindi pagtugma sa pagitan ng natural na orasan ng katawan at panlabas na kapaligiran o schedule na nakakaapekto sa kalidad at pagkakasunod-sunod ng pagtulog. Letter B, the sleep disruption leads to excessive sleepiness or insomnia or both. This mismatch cause either too much sleepiness or difficulty falling or staying asleep or both. Letter C is the sleep disturbance cause clinically significant distress or impairment in social, occupational, and other important areas of functioning. Ang problema sa pagtulog ay nagdudulot ng malalaking problema sa pang-araw-araw na buhay tulad ng trabaho, pag-aaral, o mga gawaing panglipunan. Next is the sign and symptoms of circadian rhythm sleep-wake disorder. First is the difficulty falling asleep, yun na yung hirap ka makatulog. Difficulty waking up, yung hirap ka makagising. Daytime sleepiness, fatigue or reduced alertness. Next is mood disturbance. Ito na yung irritable ka or depression. Next is cognitive impairments, tulad ng difficulty concentrating, memory problem, or poor judgment. Next is reduced performance or productivity at work or school. Next is social or interpersonal problems, tulad ng conflicts, isolation, or reduced quality of life. Next is the treatment of circadian rhythm sleep-wake disorder. The first is bright light therapy, which involves exposure to bright light at specific times of the day to shift the circadian rhythm forward or backward. Next is chronotherapy, which involves gradually delaying or advancing the bedtime and wake up time until the desired sleep-wake schedule is reached. Next is melatonin, which is hormone that regulates the circadian rhythm and can be taken as a supplement to induce sleepiness or advance the sleep pace. The other medications such as hypnotics, stimulants, or antidepressants. Next is behavioral therapy, which involves changing the sleep habits, environment, and lifestyle factors that can affect the circadian rhythm and sleep quality. Next is the education and counseling, which involve providing information and guidance about the nature and management of circadian rhythm, sleep-wake disorder, and addressing the psychological and social issues that may arise from them. So the comorbidity of circadian rhythm sleep-wake disorder can co-occur with other medical or psychiatric conditions such as depression, anxiety, bipolar disorder, attention deficit, dementia, Parkinson's disease, and Alzheimer's disease or stroke. They can also be associated with increased risk or cardiovascular disease, diabetes, obesity, or a cancer. Kaya mahalaga na humingi ng professional na tulong at paggamot para sa mga sakit na ito at bantayan at pamahalaan ang anumang mga kasamang kondisyon. Next disorder is non-rapid eye movement sleep arousal disorder. So, ang non-rapid eye movement sleep arousal disorder are characterized by incomplete awakening from sleep, usually in the first half of the night, and impaired memory and awareness of the episode. They are thought to result from a partial or incomplete transition between non-rapid eye movement sleep and wakefulness. So, next is the diagnostic criteria of non-rapid eye movement and sleep arousal disorder. First is A, the recurrent episode of incomplete awakening from sleep, accompanied by either sleep-waking, sleep terrors, or confusional arousal. This means that the person has repeated episode of waking up partially from sleep and showing one of the following behavior: the sleep-waking, sleep terrors, or confusional arousal. So, ang sleep-waking is when the person gets out of body and walk around or those other complex activities while asleep. Ang sleep terrors are when the person has sudden episode or intense fear and screaming or crying while asleep. Ang confusional arousal are when the person has episode of confusion and awaking from sleep. Next is B, the episode typically occur during that first third of the major sleep episode. Ito ay episode usually happen during the first part of the night when the person is in deep sleep stage. Deep sleep stage are also called non-rapid eye movement sleep stage, and they are characterized by slow brain and reduced muscle activity. The episode are less likely to occur during the later part of the night when the person is in rapid eye movement sleep stage, which are associated with dreaming and increased muscle activity. Next is no or little dream imagery or recall. This means that the person does not remember having any dreams or vivid image during the episode. This is because the episode occurred during an REM sleep stage, which are not conducive to dreaming. The person may have some vague or fragmented memories of the episode, but they are not related to any dream content. Next is D, the amnesia for the episode is present. This means the person does not remember what happened during the episode. This is because the episode involved incomplete awakening the impaired awareness, which affect the person's ability to form and store memories. The person may have some partial or no recall of the episode in the morning, or they may only learn about them from their family or bed partner. Next diagnostic criteria is letter E. The episode caused clinically significant distress or impairment in social, occupational, or other important areas of functioning. This means that the episode have a negative impact on the person well-being or performance in different aspect of their life. For example, the episode may cause the person to feel embarrassed, ashamed, guilty, or anxious, or they may interfere with their relationship, work, school, or hobbies. The episode may also pose a risk of injury or harm to the person or others, or damage to property or belongings. Next is F. The episode are not attributable to the psychological effects of substance or another medical or neurological condition. Ibig sabihin that the episode are not caused by any external or internal factors that may affect the person's sleep or brain function. For example, the episode are not due to the use of alcohol, drugs, medication, or supplements, or the presence of any medical or neurological disorder such as sleep apnea, restless legs syndrome, epilepsy, or brain injury. Next, letter G, the coexisting mental and medical disorder do not adequately explain the episode. Ibig sabihin, the episode are not fully explained by any other mental or medical condition that the person may have. For example, the episode are not due to the symptoms of any psychiatric disorder such as post-traumatic stress, stress disorder, anxiety disorder, or mood disorder, or any physical disorder such as migraine, ano pa ito? Or pain. Next is the sign and symptoms of non-rapid eye movement sleep arousal disorder. First is sleep-waking. This involves getting out of the bed and waking around or performing other complex behavior while asleep, such as eating, dressing, or driving. Ang sleep terrors, ito na yung mga matinding takot at pagsigaw o pag-iyak habang natutulog, na madalas na kasama ang pagpapawis, mabilis na paghinga at pagtaas ng pulso. Then the third sign and symptoms is confusional arousal. Ito ay ang pagkalito at disorientation sa pagsisimula mula sa pagtulog, madalas na may mga bulong, mga ungol o hindi angkop na pag-uugali. Ang tao ay maaring mabagal na tumugon sa mga tanong o utos at mahirap na lubusang magising. Ang taong ay maaring bahagya o walang naaalala na episode sa umaga. The next is the treatment of non-rapid eye movement. First is the education. The person and their family or bed partner should be educated about the nature and cause of the disorder and the importance of maintaining good sleep hygiene and regular sleep schedule. They should also be advised to avoid alcohol, caffeine, and medication that may worsen the episode, such as sedatives, antihistamines, or stimulants. Next is the safety measures. The person and their family or bed partner should take measure to prevent injury or harm during the episode, such as locking doors and windows, removing sharp or dangerous object, installing alarms or motion sensors, and placing mattresses on the floor. They should also avoid waking or confronting the person during the episode, unless necessary for safety reason, and gently guide them back to the bed. Next is behavioral therapy. So, the person may benefit from behavioral therapy techniques such as relaxation training, stress management, or cognitive behavioral therapy to reduce anxiety, improving coping skills, and modify maladaptive thoughts and beliefs that may contribute to the episode. They may also benefit from schedule awakening, which involved waking the person up shortly before the usual time of the episode and keeping them awake for a few minutes to disrupt the sleep cycle and prevent the episode from occurring. Next is the medication. The person may be prescribed medication to reduce frequency or severity of the episode, such as benzodiazepines, antidepressant, or anticonvulsants. However, medication should be used with caution, as it may have side effect or interaction with other drugs, and it may not be affected for all types of episode. Medication should be used in conjunction with other treatment modalities and only under the supervision of a doctor. The comorbidity of non-rapid eye movement sleep arousal disorder may be associated with other medical or psychiatric condition such as obstructive sleep apnea, restless legs syndrome, periodic limb movement disorder, gastroesophageal reflex disease, migraine, epilepsy, post-traumatic stress disorder, anxiety disorder, or mood disorder. This condition can make the sleep disorder worse or because by the sleep disorder. So, it is important to check for the threat any other health problems so it is important to check for and treat any other health problems as they may affect how well the sleep disorder can be treated. Next is nightmare disorder. Nightmare disorder is a type of sleep disorder that involves having frequent and disturbing dreams that cause significant distress or impairment in daily functioning. So, itong nightmare disorder ay isang kondisyon kung saan mayroon kang masamang mga panaginip na nagpaparamdam sa iyo ng takot at pagkabalisa. Ang mga panaginip na ito ay nangyayari kapag ikaw ay natutulog ng malalim at ang iyong mga mata ay gumagalaw ng mabilis. Ikaw ay nagigising mula sa mga panaginip na ito at nahihirapan kang matulog muli. Ang diagnostic criteria niya is letter A, the repeated occurrences of extended, extremely dysphoric and well-remembered dreams that usually involved efforts to avoid threats to survival, security, or physical integrity, and that generally occur during the second half of the major sleep episode. You have bad dreams that are very long, very upsetting, and very clear in your memory. These dreams usually make you feel like you are in danger or in a trouble, and they happen when you are sleeping deeply. Letter B is the episodes typically occur during the first third of the major sleep episode. You wake up from these bad dreams and you quickly know where you are and what is happening. Next is C. The sleep disturbance cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. These bad dreams make you feel very stressed or unhappy, or they make it hard for you to do your work, school, or other things in your life. Letter D is the nightmare symptoms are not attributable to the psychological effects of substance. These bad dreams are not caused by something you took or use, like drugs or medicine. Letter E is a coexisting mental and medical disorder do not adequately explain the predominant complaint of dysphoric dreams. You have other problems with your mind or body, but they do not explain why you have these bad dreams. Next is the sign and symptoms of nightmare disorder. First is having nightmares that are vivid, realistic, and upsetting. Next is waking up from nightmares feeling scared, anxious, angry, sad, or disgusted. Next is having difficulty falling back asleep or staying asleep after a nightmare. Next is experiencing daytime fatigue, sleepiness, or low energy. Next is having problems with concentration, memory, or the mood. Sign and symptoms. The sign and symptoms of nightmare disorder. First is feeling anxious or fearful about going to sleep or having another nightmare. So next is the treatment of nightmare disorder. Ay, sa sign and symptoms po muna. The first sign and symptoms is feeling anxious or fearful about going to sleep or having another nightmare. Next is avoiding certain situations, places, or activities that may trigger nightmares. Next is having impaired functioning at work, school, or social situation. Next, the treatment. First is imagery rehearsal therapy. This is a type of cognitive behavioral therapy that involves changing the content of nightmare into a more positive or neutral scenario and rehearsing the new dream in the waking state. Next is hypnosis. This is a technique that uses suggestion and relaxation to alter the state of consciousness and influence the subconscious mind. Next, the eye movement desensitization and reprocessing or EMDR. This is a therapy that involves stimulating the eye with rapid back and forth movements while recalling the traumatic event that may have triggered the nightmares. Next is exposure, relaxation, and rescripting therapy or ERRT. This is a therapy that combines exposure to the nightmare content, relaxation techniques, and cognitive restructuring of the negative beliefs and emotion associated with the nightmares. Next is some of the medication that may help reduce the frequency and intensity of nightmare are first is prazosin. This is an alpha blocker that lowers blood pressure and may also block the effects of adrenaline in the brain, which may reduce the arousal and fear associated with nightmares. Next is antidepressant. This is our medication that affects the levels of serotonin and other neurotransmitters in the brain. Next is benzodiazepines, which may induce sleep and reduce the nightmares by suppressing the REM stage or sleep. Next, the nightmare disorder may co-occur with other mental or medical conditions such as first is post-traumatic stress disorder or PTSD. Itong PTSD is one of the common causes of nightmare disorder. Next is the borderline personality disorder or BPD. Ang BPD may be associated with nightmare disorder as some studies have found a higher prevalence of nightmares and dream anxiety in people with BPD. Next is anxiety disorder. Anxiety disorder may trigger or worsen nightmare disorder as they may increase the level of stress and arousal during the day and night. Next is depression. May contribute to nightmare disorder as it may impair sleep quality, increase negative emotion, and reduce coping skills. So next is sleep disorder. Itong sleep disorder may cause or exacerbate nightmare disorder as they may disrupt the normal sleep stage, increase sleep deprivation, the induce parasomnias. The some example of sleep disorder may co-occur with nightmare disorder are insomnia, sleep apnea, narcolepsy, and restless leg syndrome. Next na, the rapid eye movement sleep behavior disorder. Ang rapid eye movement sleep disorder is a condition that causes people to act out their dreams physically and vocally during REM sleep, the stage of sleep when most dreaming occurs. Normally, the body is paralyzed during REM sleep to prevent movement, but in RBD, this paralysis is impaired or absent. RBD can result in injury to oneself or others, as well as poor sleep quality and daytime fatigue. Itong RBD is a sleep disorder in which a person acts out their dreams during REM stage or REM stage of sleep. And it is a stage of sleep where the brain is most active and dreams occur. Ang diagnostic criteria of RBD is first, the repeated episode of arousal during sleep with vocalization and or complex motor behavior. Sometimes, when you are sleeping, you make noises or move around in a way that matches what you are dreaming about. For example, you may shout, kick, or jump out of bed. Next, letter B, these behaviors occur during REM sleep and are related to the content of the dreams. These behaviors happen when you are in stage of sleep called REM sleep, which is when you have the most vivid and realistic dreams. Your dreams are related to what you are doing or saying while you are asleep. Next is upon awakening, the person can recall the dream content and it matches the behavior. So when you wake up, you can remember what you were dreaming about, and it matches what you were doing or saying while you were asleep. For example, if you are dreaming about being chased by a dog, you may have been running or screaming in your sleep. Next diagnostic criteria is either of the following. A, the person has a dream mentation that is related to the behavior. B, the person has a history of or is at risk for developing a neurodegenerative disorder. Either the following. A, ito na yung you have dreams that are related to what you are doing or saying while you are asleep. So, itong B is you have a condition that affects your brain and makes you more likely to develop this disorder in the future. Some of these conditions are Parkinson's disease, dementia, or the stroke. Next is letter E, the behaviors cause significant distress or impairment in functioning or pose a risk of harm to self or others. These behaviors cause you or other problems distress or put you or others in danger. For example, you may hurt yourself or someone else, damage your property, or feel embarrassed or ashamed. Next is letter F. The behaviors are not due to the effects of substance or another medical or mental disorder. These behaviors are not caused by taking drugs, drinking alcohol, or having another medical or mental problem that can affect your sleep. Next is G. The coexisting mental disorder and medical condition do not explain the episode. You do not have another medical or mental problem that can explain why you are acting out your dreams. For example, you do not have sleepwalking, narcolepsy, or nightmares. The sign and symptoms. First is the minor movements of limbs. Next, the more pronounced body movements such as punching, flailing, kicking, sitting up in bed, or jumping out of bed. Next is vocalization such as talking, yelling, or screaming. Next is intense and frightening dreams, often involving being chased or attacked. The last is lack of awareness of the behaviors during the episode. Next, the treatment. The first treatment is clonazepam, a type of benzodiazepine that has sedative and muscle relaxing effects. Next treatment is melatonin, a hormone that regulates the sleep-wake cycle and may enhance muscle paralysis during REM sleep. Other drugs treatment is such as antidepressant, anticonvulsants, or dopamine agonists that may be effective for some people or in combination with clonazepam or melatonin. The comorbidity of RBP can co-occur with other sleep disorders such as narcolepsy, obstructive sleep apnea, the restless legs syndrome, or periodic limb movement disorder. It can also be associated with certain medication, especially antidepressant, or the use of withdrawal of drugs or alcohol. RBD can affect the person's social life, sleep quality, and health, as well as their bed partners. Next disorder is rest legs syndrome. Rest leg syndrome is a condition that causes an uncontrollable urge to move the legs, usually because of an uncomfortable sensation. It typically happens in the evening or nighttime hours when you're sitting or lying down. Moving eases the unpleasant feeling temporarily. So, itong restless syndromes ay isang kondisyon na nagpaparamdam sa iyo na gusto mong gumalaw ang iyong mga binti, lalo na kapag ikaw ay nagpapahinga o natutulog. Ito ay sanhi ng isang hindi komportableng pakiramdam sa iyong mga binti na nawawala kapag gumagalaw ka. Ang RLS ay maaring makaapekto sa iyong pagtulog at iyong mga mood. The next is diagnostic criteria of restless syndrome. First is an urge to move the legs, usually accompanied by uncomfortable and unpleasant sensation in the legs. So, nararamdaman mo na kailangan mong gumalaw ng iyong mga binti dahil sila ay hindi comfortable o masakit. Ang pakiramdam na ito ay hindi katulad ng normal na pagod o sakit. Ito ay mas parang gumagapang or kumikiliti o nangangati na sensasyon sa iyong mga binti. Letter B, the symptoms in criterion A occur at least 3 times per week and have persisted for at least 3 months. So, mayroon kang pakiramdam na ito ng hindi bababa sa 3 beses sa isang linggo at ito ay nagpapatuloy ng hindi bababa sa 3 buwan. Letter C, the symptoms in criterion A are accompanied by significant distress or impairment in social, occupational, education, academic, behavioral, or other important areas of functioning. Ang pakiramdam na ito ay nakakabahala sa iyo ng husto at nagpapahirap sa iyo na gawin ang mga bagay tulad ng pagtatrabaho, pag-aaral, pakikisalamuha o ang iyong pagtulog. Letter D is the symptoms in criterion A are not attributable to another mental disorder or medical condition and are not better explained by a behavioral condition. So, ito na yung the feeling is not caused by another mental or physical problem such as anxiety, the depression, arthritis, leg swelling, poor blood flow, or leg cramps. It is also not caused by a habit such as sitting in a bad position or tapping your foot. Letter E, the symptoms are not attributable to the psychological effects of drugs, of a drug of abuse or medication. This feeling is not caused by a drug or medication such as alcohol, caffeine, or nicotine, or some medication that make you restless. Next, the sign and symptoms. First is uncomfortable sensation in your legs that make you want to move them. Sensation that can happen on one side of your body but more commonly affect both sides equally, like both legs. Ito na yung sabi ko na hindi mapakali yung mga paa mo na gusto mo na lang galaw-galawin o ilipat-lipat. Next is sensation that get worse when you're resting and improve with movement. Ito na yung lumalala o mas nararamdaman mo yung sensation niya kapag halimbawa nakaupo ka ng matagal. Lalo lalo mo siyang mararamdaman. Next is sensation that are more severe in the evening or at night than during the day or only occur in the evening or at night. So, mas lumalala siya, mas nararamdaman mo yung sensation. Mas nararamdaman mo yung sensation niya pag gabi. This is because RLS is related to the circadian rhythm, which is the body natural sleep-wake cycle. Next is the next sign and symptoms is twitchy legs or legs jerks in the evening and during sleep. Yung panginginig ng paa na mas nararamdaman paggabi na habang tulog ka. Next is sleep problems, such as difficulty falling asleep or staying asleep due to the urge to move your legs or the discomfort in your legs. Next is the treatment. Next is the treatment. First treatment is medication. Medication tulad ng mga dopamine agonist, the benzodiazepine, opioid o anticonvulsant upang mabawasan ang pagnanais na gumalaw ng iyong mga binti at ang di komportableng pakiramdam ng iyong mga binti. Gayunpaman, ang mga gamot na ito ay maaaring magkaroon ng mga side effect o mawala ng bisa sa paglipas ng panahon. The next is iron supplement. So, if you have low iron levels, to improve the functions of dopamine in your brain. Next is other drugs. Next is non-pharmacological therapies. Tulad ng massage, exercise sa binti, pag-stretch, o yung mga mainit o malamig na pack, vibration, acupuncture, o electrical stimulation upang guminhawa ang mga symptoms ng RLS. Next is lifestyle changes. Tulad ng regular exercise, magandang sleep hygiene, pag-iwas sa mga caffeine, alcohol, or nicotine, o pagbabawas ng stress upang mapabuti ang iyong pangkalahatang kalusugan at ang iyong pagtulog. RLS may be associated with other conditions such as iron deficiency anemia. This condition where you have a low levels of red blood cells or hemoglobin, which carry oxygen in your blood. Next is kidney disease. A condition where your kidneys are not able to filter waste and fluid from your blood properly. Next is peripheral neuropathy, a condition where the nerves in your arms or legs are damaged, causing numbness, tingling, pain, or weakness. Next is pregnancy, especially in the third trimester. Due to hormonal changes, iron deficiency, or pressure on the nerves or blood vessels in your legs. Meron pa the Parkinson's disease. a condition where the brain cells that produce dopamine die, causing problems with movement, balance, and coordination. The next disorder, the substance medication-induced sleep disorder, is a condition where substances or medication affect your sleep quality and quantity. It can cause problems like insomnia, daytime sleepiness, nightmares, or sleep-waking. It needs medical attention and treatment, and may be related to other health or mental issues. Ito ay isang uri ng kondisyon sa pagtulog na sanhi ng paggamit o paghinto sa paggamit ng mga drug, alcohol o gamot. Ang mga sangkap na ito ay maaring makakaapekto sa utak at katawan sa iba't ibang paraan at magdulot ng pagkaabala sa normal na cycle ng pagtulog. Na yung mga kakakos niya ng insomnia, daytime sleepiness, or etc. Next is the diagnostic criteria. The letter A, prominent and severe disturbance in sleep. Ibig sabihin that the person has a serious problem with sleeping, such as difficulty falling asleep, staying asleep, or waking up too early. The sleep problem is not just a minor inconvenience, but affects the person's quality life and well-being. Letter B, the evidence that the sleep disturbance is caused by the substance use or withdrawal or exposure to a medication. Ibig sabihin that there is evidence that the sleep problem is caused by the use of substance such as alcohol, drugs, or caffeine, or medication. Antidepressant, steroids, or painkillers. The evidence can be based on the timing of the substance use or withdrawal, the type and dose of the substance or medication, or the known effects of the substance or medication on sleep. Next is letter C, the disturbance is not better explained by another sleep disorder or a medical or mental condition. Ibig sabihin, that the sleep problem is not better explained by another sleep disorder such as insomnia, narcolepsy, or sleep apnea. It also means that the sleep problem is not better explained by a medical condition such as thyroid disorder, a heart disease, or neurological disorder. It also means that the sleep problems is not better explained by a mental condition, such as depression, anxiety, or post-traumatic stress disorder. Letter D. The disturbance does not occur only during a delirium. Ibig sabihin, that the sleep problems does not occur only when the person is in a state of delirium, which is a severe confusion and dissertation that can be caused by substance intoxication, withdrawal, or medical illness. Delirium can affect the person's attention, memory, perception, and behavior. Letter E. The disturbance cause significant distress or impairment in functioning. This means that the sleep problem cause significant distress or impairment in the person functioning. For example, the sleep problem may cause the person to feel tired, irritable, or depressed. It may also affect the person's performance at work, school, or home. It may also increase the risk of accidents, injuries, or health problem. Next, sign and symptoms. The sign and symptoms, first is insomnia type. Nakikilala sa pamamagitan ng kahirapan sa pagtulog o pagpapanatili ng tulog na madalas na pagising sa gabi o hindi nakakabawi ng tulog. Next is daytime sleepiness type. Ang katangian ay pangunahing reklamo na labis na antok o pagkapagod sa oras ng pagising o mas bihira. Isang mahabang panahon ng pagtulog. Next is parasomnia type. Characterized by abnormal behaviors or experiences that occur during sleep, such as nightmares, sleep wakening, or sleep terrors. Next is mixed type. Ito na yung more than one type of sleep disturbance relative symptom and non-predominates. Next is the treatment, identifying and addressing. The underlying substance use or withdrawal or medication exposure and providing appropriate detoxification or substitution therapy if needed. Next is providing education and counseling on the effects of substance on sleep and the importance of good sleep hygiene practices. Tulad ng maintaining a regular sleep schedule, avoiding caffeine and nicotine, and creating a comfortable and quiet sleep environment. Next is using pharmacological intervention. Gaya ng cognitive behavioral therapy, relaxation techniques, or stimulus control to help reduce anxiety and negative thoughts about sleep and improve coping skills and mood. Next is using pharmacological intervention. Ito yung mga melatonin, sedative hypnotics or antidepressant to help restore normal sleep patterns and reduce insomnia or daytime sleepiness. However, this medication should be used with caution and under medical supervision, as they may have side effect or interaction with other substance or medication, or may cause dependence or rebound insomnia. The comorbidity, substance or medication-induced sleep disorder often co-occur with other medical or mental condition such as chronic pain, cardiovascular disease, respiratory disorder, mood disorder, anxiety disorder, or psychotic disorder. So this condition may worsen the sleep disturbance or be worsened by it, creating a various cycle. Therefore, it is important to assess and treat and co-occurring condition along with the sleep disorder. So, other sleep disorder. Other specified insomnia disorder. This is a type of insomnia that occurs at least 3 times per week for at least 3 months but does not have a clear cause or is associated with other medical or mental condition Some possible reasons for this disorder are poor sleep, hygiene, environmental factors, or psychological stress. Halimbawa, maaring mayroon kang mga masamang gawi sa pagtulog tulad ng paggamit ng iyong cellphone bago matulog, o maaring mayroon kang maling pananaw kung paano ka katagal natutulog, o maaring mayroon kang isang side effect mula sa isang gamot o sangkap na nakakaapekto sa iyong pagtulog. Next is unspecified insomnia disorder. This is a type of insomnia that occurs when you have a trouble falling asleep, staying asleep, or waking up too early, and it affects your daily life. The cause of your insomnia is unknown, or there is not enough information to make a more specific diagnosis. For example, you may have hypersomnia due to a combination of factors, or you may have hypersomnia that is not related to any other medical or mental condition. Next, the other specified hypersomnolence disorder. This is a type of hypersomnia that occurs when you feel excessively sleepy during the day, even after getting enough sleep at night, and it affects your daily life. The cause of your hypersomnia is known, but it does not fit into any of the other categories of hypersomnia. For example, you may have a sleep disorder that makes you feel too much, such as insufficient sleep syndrome, recurrent hypersomnia, or hypersomnia due to a medical condition. Next, unspecified hypersomnolence disorder. This is a type of hypersomnia that occurs when you feel excessively sleepy during the day, even after getting enough sleep at night, and it affects your daily life. The cause of your hypersomnia is unknown, or there is not enough information to make a more specific diagnosis. For example, you may have hypersomnia due to combination of factors, or you may have hypersomnia that is not related to any other medical or mental condition. Next is other specified sleep-wake disorder. This is a type of sleep-wake disorder that occurs when you have an abnormal pattern of sleep and wakefulness, and it affects your daily life. The cause of your sleep-wake disorder is known, but it does not fit into any of the other categories of sleep-wake disorder. For example, you may have a sleep disorder that makes you feel that make your sleep-wake cycle irregular, such as irregular sleep-wake rhythm disorder, non-24-hour sleep-wake rhythm disorder, or shift work disorder. Next is unspecified sleep-wake disorder. This is a type of sleep-wake disorder that occurs when you have an abnormal patterns of sleep and wakefulness, and it affects your daily life. The cause of your sleep-wake disorder is unknown, or there is not enough information to make a more specific diagnosis. For example, you may have a sleep-wake disorder due to a combination of factors, or you may have a sleep-wake disorder that is not related to any other medical or mental condition. That's all. Thank you.